Hey, everyone, and welcome back to the Medical Fitness Podcast, powered by the Medical Fitness Association and the Medicine Rehab Fitness Institute. As a reminder to our listeners, this is a second part of a two-part episode with the legendary Dr. Bill Kraemer, who is arguably the premier sports scientist and strength and conditioning researcher in the world. If you missed part one of our talk, please make sure to check it out. I'm going to begin this episode with where we left off in part one, and I hope you enjoy our conversation.
And you get feedback just like we're doing at Ohio State now, trying to understand the different elements. And there's so many different versions. So this book came out really as something I wanted to say. So the only reason you write a book is to educate people, like we're doing with our fourth edition of XViz book. That's really to educate young students. This book was written really to say what I wanted to say about athlete development, because I've worked with it my whole career. And I tried to do it to myself, and I didn't know. I wish I would now be 12 years old and know that I could have somebody working with me with all these principles.
Yeah.
My career, and that happens, But we're still. My final point I'll make is athlete development, player development. We're really just crawling out of the cave. So we got all the technology and the bells and whistles and everything else, but we're really just kind of crawling out of the cave yet to actually get it implemented and translated to that athlete in total. And some places, I believe we're trying hard to do it right with the Human Performance Collaborative at Ohio State, and then you have the Performance Innovation team, and then you have the whole team over here of athletes and performance coaches trying to meld together in commonality, doing that type of thing. But again, it's still, everybody has various versions that they're doing at various universities, but we're still, crawling out. And then a lot of the health fitness world will try to use a similar model. We got asked that question. And the model works because everybody is an athlete somewhere, even if you're a cardiac rehab patient. When I was at Wyoming, I had ranchers that had to recover from, heart attacks or bypass surgery. And in the old days, they would just say, well, you go back. Well, you're a rancher, you got to be hoisting bales, feeding cattle, riding horses. How can you do that if you've just been doing your walking? You got to do some lifting. You got to reduce the amount of heart stress by increasing peripheral, strength, so that the heart stress is less. We've learned that over the years. Avery Fagenbaum and I, when he was a student at BU and I was on his committee and worked with him, we did both the master's and a PhD work with the group up there, showing that you can do acute weight training pretty heavy. Just don't do the overheads with, the early phase rehab. And basically, you also can train people. And that was kind of early going in the early 1990s. But so it really is a book that basically was encompassing a lot of things I wanted to say. Couldn't say it all, as you know, but it gives the tips of the iceberg for people to at least have to think about something.
So much of what you're saying is like, as you actually just alluded to, my world is medical fitness, as obviously this is a medical fitness podcast. And so much of what you said just crosses right over. And first of all, let me just on a side note say that not only should people be purchasing and reading this book, but like your classic text series, like the science of practice and strength and conditioning, you're designing resistance training programs, optimizing strength training. Like in my biased opinion, people should be purchasing all this stuff to get much more well-rounded view of what you've put out and all that stuff. It's reading these books and staying on top of just research in general, but also what you're putting out is part of the reason why I have the confidence that I do. But now jumping to my main point, when I go present, I do a lot of presenting over the last several years at medical conferences and rehab, like the American Physical Therapy Association. I have one coming up this fall for occupational therapy, etc. And what you just said is the things that I include in a lot of my talks. Is number one, you need some of the higher, like if you're just, for example, looking at the 6 to 15 or 4 to 15 rep spectrum, you don't want to spend all your time training down at the bottom of the spectrum for various reasons. Maybe you're increasing the risk of joint injury or pain, and central nervous system burnout or whatever. But you also don't want to spend all your time training at the high reps with lighter weights because you're not going to optimize or help with strength and all the tissue adaptation and resilience that goes on down in the lower rep ranges. But the point is that I just feel like, and since I'm student and your teacher, I'm actually going to ask you a question here because one of the things I talk about is um, the importance of training across in a periodized fashion, whether it's linear or preferably nonlinear, obviously flexible and taking auto regulation and all those other concepts into consideration. From a rep range standpoint, I just feel like across the entire lifespan, we need to be training across at the very least that 6 to 15, 4 to 12, 4 to 15 in some sort of periodized fashion so that we can get the benefits that each rep range has from an adaptation standpoint. I'd love to get your response on that.
Well, yeah. I mean, I think first of all, you got to realize that across the age span, you have a completely different context when you deal with, young athletes that are soccer players playing 3 games of soccer in a given day. Willam, the famous orthopedic surgeon, worked at Children's Hospital in Boston and still advocate. When I first met him, we talk about the fact you should really, if you could play a sport, you should be able to train for it. Well, obviously, when you talk about and you work in the Center for Aging that I did at UConn and at Penn State and different aspects, you get people up in frailty areas, this type of thing. You find out that they have low bone density and they're osteopenic. Well, you're going to put them on a heavy leg press, they may break a bone. So again, everything has context, but I think the key thing is you work as we do in any type of thing. You work around the actual limitations that the individual
Yes.
has. You have to
Yes.
realize that you're not going to, Avery Fagenbaum did some of the really neat studies with young children that you can teach them how to do various movements. You can teach them how to lift. They worried about lifting heavy. That was the big thing in the 70s. The kids don't lift heavy, stunt girls. Well,
Yes.
the problem is you can test them and it's not going to hurt them. The bottom line is you have to, it's a relative phenomenon. It's a relative type of phenomenon. But you also got to realize if they're an athlete, first of all, once the sport goes back to the book, what are we training for? As Dr. Fleck would always say, what are you trying to get good at? Well, you're trying to, in my mind, increase, if you can, you're trying to increase muscle stiffness and tendon stiffness. And a lot of times people don't know what that means. Tendon stiffness is that your tendons are being developed with collagen type of matrices, and the amount of density they have is important because when you have low density tendons where it can break easy. So tendon stiffness is you have more rigid matrices, so that basically you're not going to be able to pull it apart as easy or break it, because it goes back to a fundamental engineering concept that you have materials that are stronger will break at a higher amount of opposing forces, obviously. So we want you to have the good enough tendon stiffness to, in fact, be able to resist deformation and resist type of breaking. And to do that, you have to lift heavy up toward the more maximal levels. And that's why a lot of the tendon stiffness programs, they use isometric formations at the different distances. They then do heavier weights that you need to do with the dynamic lifting as well to increase that strength. There's a big story we could tell on that. And then muscle stiffness is where you're basically trying to, when you have the muscle elongating, have it be able to resist elongation or be able to tolerate the eccentric loading by having strong binding occurring with each of the interfaces with regard to the stretch shortening cycle. You got, excuse me, the shortening cycle. So when an actin filament's here and a myosin's here, it strong binds and resists if this doesn't get ripped away, and not just have electrostatic binding or getting ripped away real quickly. So you do plyometrics, you do power exercises that allow for this higher velocity capability, and also the strengthening does as well. That's why you train across the full continuum, by the way. But you got to do other type of work. So a common type of thing people will do, for example, they'll do an isometric squat at the parallel level, and they'll follow it up by plyometric jumps. This type of thing. They'll ramp them together. So you're getting tendon stiffness training and muscle stiffness training. But again, the loading is what does a tendon stiffness, and then it's a variety of functions across the continuum of really the force velocity curve is what we're talking about. And remember, there's a concentric force velocity and an eccentric force velocity curves. And so we train the different types to get better at those I mentioned before, the stretch shortening cycle. That's why plyometrics, you do the elongation before the rapid concentric shortening. And then basically that is why we look at the continuum of loading across a big stretch, the big stretched way along that large force velocity curve, typically concentrically, because we seem to focus on that. And eccentrically, although you could do eccentric training, and some people get in and say, well, just train eccentric. Rob Newton, another former postdoc student of mine, Perth, Australia, we found that when you try to accentuate one over the other, basically you find out that you reduce the concentric load because it's energetic. And the late Gary Dudley, another good friend of mine who was a genius scientist, another very good colleague over the years, did some outstanding research on the Connacht rep, and he found and concluded, and he's a very, very what amazing scientist he was. He was another good friend and mentor as a colleague as I went through my career. And Gary found out that you really need the Connacht rep is the best way to go. You really need the Connacht rep because you do one or the other, you don't get the benefit of that duality.
It makes
So
total sense.
that whole phenomenon is that, yeah, if you look at what when I was at a conference years ago in Norway, Per Ergaard in southern Denmark said, yeah, you can do eccentric heavy training if you're dealing with an athlete or somebody basically for a frame of time that you're getting ready for long jump or high jump. Just the same thing with all the new stuff on blood flow restriction. It probably is good for somebody coming off a different context of detraining or rehab or whatever. But you got to understand how you're using the tool, and that basically ultimately it still goes down that you fix form exercises that are on machine based where you don't have any balance, whatever, and you have free form exercises where you have to control the mass in three-dimensional space, multi-dimensional space. So the bottom line is that we're really talking about rep ranges that are going to be going, typically the Connacht reps, that are going from across the force velocity curve. When you get under 3, you're into really skilled type of lifting that power lifters, Olympic lifters do. But basically, you don't be afraid or make anything evil, whether it be a rep range, whether it be an exercise, because it's nothing more than a tool in the toolbox that you use appropriately with the right prescription to the right person. No different than what physicians do. And the one Maria Fradioni Sai, who's at the Center for Strong Medicine in Sydney, Australia. She was at that original Tufts lecture that I gave on strength training in 1988 when she was there, and when I unfortunately made 80%, the big percentage we all should be working at. I was just a starting of one part of a heavy continuum. I didn't mean to be the be all go all for aging, but she said, weight training is really a medicine. It's like prescribed, and it's a dose response and everything else. And she's been a big supporter of kind of the concepts I put forth. And Maria really done a lot of great work from that with that concept in mind in the medical world too. So that's kind of what we deal with. We're talking about rep ranges and what we're looking at. It's just the Connacht rep over that range of things, depending upon who you are. I mean, if you have somebody that has a ton of pain with certain movements like osteoarthritis, you can only do so much. But you work as much as you can within the limitations across that continuum, however big or short it is. But to say I'm not doing any heavier stuff for you relatively, or I'm not only doing light stuff, or I'm only doing heavy and not light, remember, it's relative too. Heavy for you may not be heavy for me. So it's all, but it's the idea that you did heavy for you and you also did light for you. And you are context unto yourself. And that's medically, that's what you have to deal with. That's what physicians deal with when they prescribe medications. And then you observe what the effect is. Does it improve? Does it help? Does it hurt? That's where your testing and your workout logs have to be pristine so you can, in fact, understand what you're going to do next and how you're going to prescribe it and how you progress it in the sequence of training.
I love it. And um, some of what you said, since we were talking about physiology, it actually reminded me of my next question for you, which I'm going to start with a short story just for your sake and because I love reminiscing and also for the audience. I graduated from Penn State in '96. Flash forward to 2007. I'm in your office at University of Connecticut. We're talking about programming. And at some point during the conversation, you asked me if I was familiar with the size principle. And I responded to you by saying, I've heard of the size principle, but I'm not familiar with it. And my memory and recollection is that in a very professional way, you kind of scolded me a little bit, but I do not say that negatively at all. You scolded me a little bit, and you basically said that, again, I'm paraphrasing here, but my memory is that you said something like strength training or resistance training as a system revolves around the size principle. And you had a chalkboard in your office, and say you went into teacher mode and you got your chalk, got on the chalkboard, started drawing the representation of a muscle and motor units and stuff like that. I'm going to let you take it from here. But that was also just a huge moment in my career, light bulb. I was like, you were just teaching me something that I could tell was just so important that I just think everybody should know, whether it's coach, fitness trainer, or clinician, how important this concept is.
Well, I think, I was impressed because as a physiologist, I was also in obviously with the work we're doing in brain sciences now over the years, I was in, neuromuscular. So I was in neuro. And in graduate school way back when, I ran into the concept of this size principle that Elwood Henneman spent his entire life working on, and that it was very much interested because as a zoologist, he looked at these big nerves, squid neurons. You could do a lot of things with back when I was in the zoology physiology department. Squid neurons. The neurons are big ropes. They're not little indivisible things we deal with. But anyway, reading all of his work, it became apparent way early in my doctoral career that basically size principle is one of the major issues that we have, and that means that motor units are recruited in a very structural manner from low threshold to high threshold based on the external demands. So if you're going to just lift the pencil up with this movement, it doesn't take many motor units to lift the pencil back and forth like this. And the body is very efficient. It will just recruit the low threshold motor units in that movement that's needed. They'll stabilize with others. Your arm's probably taking more motor units to stabilize than it is to push the pencil up in the direction that you're going. So the bottom line is, as you increase the external load, heavier and heavier, basically you've got to go up the ladder to get bigger and bigger motor units. And motor units, the sizing principle came out from Henneman's work that it could be the number of motor units fired, it could be the size of fibers in the motor units. So the motor neuron is really the alpha motor neuron and its associated fibers. And one of the things that came true in a lot of the work, and I've not seen too much differential, there's such things as hybrids, but for the most part, motor units are pretty pure in the type of muscle fibers they have, unless there's been some type of damage and another neuron picks up a damaged fiber, but in time it creates what it is. That's a subtopic. But in reality, if you get to those higher and higher motor units, you have to have higher and higher electrical forces. So you got to have a bigger hertz. I always talk about a 220 and a 110 cord. If you're lifting a light weight, you got that 110 volt going through the motor units and you've activated because every one of the motor neurons, in order to be able to be fired, it has to reach a certain threshold, electrical threshold, before it fires all or none. And then it fires. And basically, as you go up the ladder, you need a higher and higher hertz. And that is because, in fact, as you start looking at different motor neurons, they have different densities of the nerve size. You need a much bigger charge to get depolarization because their ions are so many more that you need a big charge to stabilize all that to get the threshold charge to go through. And there's a lot of fun stories about that. But anyway, so what it translated into in my world back in the day was that if you're going to recruit these certain fibers, which we call fast twitch fibers, but now type 2 fibers, you've got to get heavier loads because they got to go up the ladder. And that's going to take a big hertz. And if you're going to lift light weights, you only need light weights. And so you only train what you activate. That's one of the concepts I just working on a chapter right now. And it's one of the things we always bring out in most all my chapters. You know, size principle. The only fibers that get trained are the ones that are activated, and so they are activated, and now they get into a training mode. Now, how long you do it, what type you do it, blah blah blah. There's a lot of factors, but if you haven't activated the motor unit, the fibers associated with it don't get trained. The other thing is that basically we know from size principle that it's not only concentrically loaded, but eccentrically loaded. That's where people got all excited about just lifting eccentrically that I've talked about before, that really the contact rep is better. But eccentrically, size principle still works. So you have the whole phenomenon that loading dictates the amount of hertz you need to fire all the type of units that you're trying to get the motor units. And the motor unit, again, alpha motor neuron and fibers it's associated with to get whatever type of force, whether it be concentric force or eccentric force, which is going to be heavier than maximal isometric, to get to be fired. And then you get into people saying, well, we'll just do isometric training. Okay, guys, that's a great idea, good tool, but that's only one point in the range of motion on the strength curve. Now, if you're going to train that entire strength curve, you're going to have to spend a lot of time going up, down with all the different isometric holds that you're going to do and pushes. So that's why from the 1950s, when isometrics were really excited because of the space race, the ability of people being put in little capsules for long periods of time, that became a big part of the idea of training for microgravity, which still we're working on many different aspects of that now, even with the chase to go to Mars, which will really require artificial gravity to be created. That's a whole other thing that we've played with in the past. But the bottom line is that Henneman was a very prolific scientist at Harvard. He lived all the way to 1995. And I wish, there's a few people that I was unaware they were still living. And I got to say this, from Thomas Delorme to who was in Boston, to Elwood Henneman,
Yeah. Three
who
sets of 10. I know who that is. Three sets of 10.
right, who I could
Yeah.
have went and visited. And Thomas Delorme, again, was one of the first medical guys, really the founder of the Spalding Clinic that exists out there now in rehab. He was basically remember everything he did was part of a rehab program, but he
Yes.
was a very good lifter unto himself. In fact, he wanted to challenge Bob Hoffman to lifting because he was very
Ah,
much of a good lifter himself. If you go and look at Jan Todd and Terry Todd, my late friend Jan Todd, historians out at the Stark Center, they've written some great history. They've got a great historical museum down there with tons of information. But if you look at the history that's been published on top on these really heroes that have been around, to me, because of what they did in the world of strength training and how it connects to what we do. And even, but here I didn't realize he was that close, and I just, you don't realize things. And that's one of the things that I think that I tell all the young people out there, young professionals in your 20s, 30s, even 40s, find the people that are these people and take the opportunity to meet them and sit down with them and really have a conversation, because I missed that because I was so tied up in my own, momentum of what I was doing career wise. I look back and it's sad. Because I remember being teaching at Ball State, and one of the students asked me if Dave Costa was dead. Well, he's down the hall. He wasn't dead. He's
huh.
retired, you know. So the bottom line is, it's important that we understand. But Henneman, the size principle is really every time you do any exercise, you can say, well, what's being recruited, and it's based on the external load. One of the things we found out that I just wrote about is that it was an interesting study we did in our Pioneer big study we did with compatibility when I was in the Army, published it later, was the fact that when you could do high intensity aerobic, high intensity interval training, but that oxidative stress really is counterproductive to really hypertrophy. You get a decreased type 1 fiber sizes because they're trying to obviate and produce better oxygen transport distances between the blood flow and the mitochondria, and basically big fibers don't deal with that because they're not being recruited for that. But also the fact is that we've thought, well, geez, maybe if you do really high intensity intervals, you'll get hypertrophy, but you never get the Hertz level that you need to get those big high threshold motor units. That takes resistance exercise. And then what happens if you do high intensity, you don't periodize it right, you don't imagine it right, what happens is that you'll get hypertrophy in the type 2 fibers with the loading, but your type 1s will be they'll be not knowing what to do, and they won't know what to do. So they'll stabilize. They'll stay. You gotta get big. You gotta get small. They go nowhere over hard training for 3 months with what we did at the time with the 101st, 82nd Airborne. It wasn't like they were not putting out all they could. So we learned a lot of things about that. Is another area of compatibility, but size principle goes back into what you're recruiting, and then what's the context of it, and everybody deals within their spectrum of what they can do medically, which this podcast is about. But one thing Bill Evans found that we did with the studies, and he was good at this, is that every pathological population that we ran into benefited from weight training. That
Yeah.
they could do, whether it was cancer, whether it was any type of thyroid aspects. We found out that type 1 people that are type 1 diabetes or type 2, well, you got to know what the challenge is and how to prescribe it. So there's all these different medical aspects that within the context of that spectrum of what you're capable of doing from heavy to light, again, that varies depending upon your limitations. You can train across the spectrum. And then finally, you mentioned it many times, variation is the umbrella term for all the periodization models. It's
Yes.
variation in it, and the variation of the sequence of training is sometimes individualized, and you can use all these different block, conjugate, or whatever you want to say. You could use it as models, but it comes down to how does that work for that mesocycle, 8, 10 weeks, 12 weeks. How does that work for one individual and over the macrocycle, the long area? And sometimes you don't make as much variation. Sometimes you can. Sometimes with some athletes, we find we can go heavy, 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 and then rest, rest, rest. Where we get into the fact that if we have an individual that's so weak, and basically a young individual that does not medical issue, just weak individual, we got to lift heavy more than often. So the mesocycle is based on heavy lifting with light weights just for recovery. But and so the bottom line is that that's where flexible nonlinear and dividing mesocycle can be what I call in one book a chameleon, because it basically can take on whatever sequence protocol you want. In some cases, they need the dose of heavy more than they do recovery, because you can't recover very much if you don't do much. So it begs it. So there's a skill set involved with prescription, just as
Yes.
different physicians, therapists, trainers all have skill sets of how well they diagnose and how well they prescribe and how well they look at the prognosis and all these type of phenomena. And I've been around the medical world at 3 medical schools forever, a ton of physicians over the years. You can see that's what separates out the really exceptional ones outside of good personality, which always helps, and basically kind of fits into type of modeling with regard to strength training.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Attention, all medical fitness professionals. Get ready for the event of the year. Register today for the Medical Fitness Association Annual Conference, November 19th through the 21st in New Orleans. Network with industry experts and like-minded professionals from around the U.S. and Canada. Gain insights from leading voices in medical fitness and take your career to the next level. Don't miss out on this incredible opportunity. Mark your calendars for November 19 to 21st and join us in New Orleans for the Medical Fitness Association Annual Conference. Register now at medicalfitness.org. That's medicalfitness.org.
Yeah, and again, so much of what you said, I wish I could respond to everything, um, but I'll respond to a couple things. Number one, what you just said kind of dives into my world and my frustration, where we work along a continuum. It's not a totem pole where where a physician's above advanced practice provider, who's above an allied health professional, who's above a fitness professional. We work along a continuum, and we need to respect each other's roles, responsibilities, and skill sets along that continuum. And obviously you talk about it a little bit in your book, because talking about the team, as a matter of fact, I didn't know when I was at Penn State that the Center for Sports Medicine was one of the first, or if not the first, that team concept. And so that's one of the things I talk about, again, when I'm at conferences or whatever, is we're a team and we need to see it that way. And because ultimately it's going to benefit whether it's the patient, the client, the athlete. When you work as a team, that's what benefits the most. But I want to now real quick,
Well, I just
and
want
this
to
is a
say
little
one
bit,
thing that
sure, go ahead.
is important. In the book we talk about, and I've seen this, you got to have alignment. If you don't have alignment with the whole group, you have
Yes,
dysfunction. And alignment that we talk about. That
yes,
means that you have to have alignment of everybody on that team that does just what you said, respects everybody for their skill sets, but also challenges them. And also
yes,
that the three C's and evaluates that aspect too. There have been many teams that can have really one donker that basically wrecks it all because they have no skill sets and they have no see the three C's. They're incompetent, whatever, and basically that is the disruptor of a good team. Just like having, if you don't have a good quarterback that can actually throw the ball, it doesn't matter if you have all American receivers. You've got to have each element of every unit has to be at the level where the performance is at the level that you are trying to make it at in development, with
ex
player development, patient care. You still got to have a good team of people that work together, question, discuss, and use evidence-based practice to get those discussions going that we put in the book as well.
exactly. And look, I'm approximately 30 years into my career. I've been at Duke, I've been at UCLA, Mount Sinai, Beth Israel, and so I've experienced both the good and the bad side of the team concept, and the facilities that did it right and the facilities that didn't do it so right. And so it's that when you're on the wrong side of the fence, for lack of a better phrase, it's frustrating, but at least then you're ultimately, in the big picture, you're going to learn from that. And so I'm, I wish we lived in a perfect world where there was no wrong or bad side of the fence, but I'm glad that I experienced it, because it makes things more clear how to do things the right way and have the team that, just like you said, that's working together, that's challenging and pushing each other. And I'm very fortunate to have been in those types of situations and know exactly what you're talking about. But real quick, I want to jump back. This is a little bit on a personal note, but I want to get your response to something as it relates to the size principle. I want to jump back to 2007 when I'm in your office, and one of the you know today you use the pencil concept, but back then what you said to me was like a bicep curl. And if I remember correctly, you said, like, if you had a 5 pound dumbbell and you did a curl with it, to the naked eye it might look like your whole bicep is contracting, but under a microscope it's really only the motor units that need to produce force, and that the rest of them are resting. And if they're resting,
Yeah,
if they're not producing force, they're resting, and you're not training them, blah blah blah. So now I want to jump to my wife real quick, who you might know has was diagnosed with multiple sclerosis 20 years ago, and now here she is. She just turned 48. She's 5'4". She weighs 130 pounds, and so at 48 years old, 130 pound body weight, and she's deadlifting Like she can deadlift 300 pounds for like 3 or 4 reps, which is more than 2 times her body weight with multiple sclerosis. She can squat and like legit squats to depth with just a few weeks ago she got 210 for three, which is again 1.5 times her body weight, blah blah blah. She's dumbbells press chest pressing with depends on the rep range, but 45, 50, 55 pound dumbbells. She's had 60s in her hands for like two, etc. And one of the things that you kind of create a monster because when you learn these things that and realize how important they are, such as the size principle, and I can't wait for your response here. Then you realize, man, everybody needs to know this. And you know who else needs to know it? Neurologists. Because there's so much underdosing going on. And we could talk about it in the orthopedic world, and basically in just the world, there's just too much underdosing going on. But just as it relates to the health of the nervous system, if you aren't activating it, then you can't possibly be training it. And one of the things you'll say in like you and Dr. Zatsiorsky say in the Science and Practice of Strength Training book, if I recall correctly, is that there needs to be a level of fatigue in order to train something as well. But the point I'm trying to make here is from a neuroplasticity standpoint, just the health of the nervous system. If you're always going light and underdosing because you're afraid to flare somebody up or whatever, the intent might be good, but you're actually doing a disservice because my wife has went from 5.5 years of just spiraling downhill. It was horrific for me to sit back and watch and not be able to do anything about, for those first 5.5 years after she was diagnosed and seeing the daily flare-ups and the wide variety and how sick she was, and she was just getting worse and worse. And I didn't know enough at the time to feel confident to put her on any type of a program. But then I started Mount Sinai. Now I have uh, clinicians that I can at least pick their brains. And in hindsight, look, they were helpful. They don't know anything about exercise science and programming, but at least I was able to pick their brain while at the same time I'm picking your brain. And I'm starting to get confidence. And finally, I put her on a program. And from like a time span standpoint, I was afraid actually for a while to move her down to 8 repetitions per set or 6 or 4. So we kind of kept her up there at 10 to 15 for, I don't know, maybe a year and a half, 2 years. But then we started to dip down at 8 repetitions per set just for a phase, whether it was a 3 week phase or whatever, see how her body responds. Oh, it's responding extremely well, both mentally and physically. She's responding well. Now our spectrum spanned instead of 10 to 15, it spanned to 8 to 15. And then we do that for a while, and then we dip down to 6, and oh, her body's responding well. So now we aren't afraid of it anymore. We started including that into the overall programming scheme. Then finally down to 4, etc. In hindsight, she's gone from sick every day to she's been re-diagnosed as her multiple sclerosis has been re-diagnosed as inactive and benign. And so I saw someone go from very sick to healthier than most people who are considered apparently healthy. And I just feel like understanding of the size principle is such an important part of that because of the need to activate motor units and create new signaling pathways and lead to neuroplasticity and all those things. So I would love to get your response on, on that basically just in general and the medical side of the size principle.
Well, no, I think first of all, we don't have enough data to really understand, really progressive heavy resistance training, as was formulated by Thomas Delorme, who again is the founder of the Spalding Clinic up in Rehab Center Clinic up in Boston, to really understand what we are dealing with. I think the problem is that many times what we're dealing with is to do the individuals recover from that particular training workout. I know myself with all my osteoarthritis, I did a hard workout in intervals and thing, and then I lifted, and my body you can tell right away the body rebelled, the orthopedics rebelled, the knees, the patellar tendons went into major. I quit. And so, that comes back to the fact that I think you were smart. You dose carefully and then you tip. You dose carefully. I think it's when I think a lot of people get frustrated and they just go crazy. And then the next thing you know is they don't recover. So
Yes.
it's a stress recovery phenomenon. And as far as God bless your wife, as far as MS and many other type of chronic type of pathologies, we don't know a lot about how you know lifting and weight training in general is going to impact that. But the nervous system, we now know we have a large study right now just trying to look at the role of strength in the brain function, and that's part of an NIH panel, Dr. Hayes at Ohio State, and how it plays into that role in cognition and everything else. And there's just a lot of things we don't know. I do know that because you have to recruit a high threshold motor unit, you do get reorganization of the brain functions very dramatically compared to light. And there's been a lot of work done on endurance exercise, not much on strength, but I think when you look at the amount of electrical charge that you have to develop in the M1 motor cortex, and then have to be able to facilitate through the cerebellum down to the periphery, it's a much different phenomenon than you have to just facilitate very low threshold type of hertz electrical charge, because we're electrical beings in reality.
Yes.
And
Yes.
that's the problem. And how our external environment affects our electrical status is really important. So I wish I could bench 500 again, squat 700, but those days are probably gone. And the point you brought out earlier, if you don't, we found out with our aging research, especially if you don't use it, you lose it, because
Yes.
apoptosis actually occurs. Well, those high threshold motor units that basically are there, if they're not activated, their apoptotic lifestyle is different. So if you look at Lars Larson, who was at Penn State for a number of years before he went back to Karolinska, they found early on, back in the 1990s, that you men's fibers, with kind of older men's fibers, what they looked like were where the type 1 fibers were larger than the type 2 fibers. And what we also found out in many women, that's what happens too. Their type 1 fibers are larger than type 2 fibers. And it primarily is due to the fact they haven't been recruited. Well, why aren't they recruited? Because they didn't use heavy enough weight. So what happens when you start training now, even in women, it takes a delay. They finally get their type 2s bigger than their type 1s. And in older men, the same thing happens. You got to rescue the type 2s to try to bring the ones that are left that didn't die off to do that. So there's benefit from that, despite the fact that we're all fated to be losing with apoptotic cycles, we're all fated to lose the type certain muscle, certain cells, because we're losing hydration of the cells. The DNA is changing, and not water hydration. I'm talking reason to shrivel up is my wife, my mother was 103 when she passed away, and she was shriveled. And wonder why. Well, part of it's the hydration of the cells, which was the topic of one of my graduate school papers, that the hydration of cells actually you're losing hydration, cellular hydration. So the bottom line is that, and by the way, you win the Nobel Prize, you can tell me how water is stored in the body. Nobody has really figured that out yet either. And it's not the H2O we think of, but it's a fluid form. But anyway, yes, you're right. If the size principle is that you are charging the body with a higher hertz exposure with heavy
Yes.
weights and lighter weights. The question is, how do you dose it? How do you recover from it? And that's the key that we don't know. And it affects everything from the brain hubs all the way down to the peripheral effects.
Love it. All right. Hey, I have two more questions for you, and then we'll wrap this up, even though, again, I appreciate how much time you're spending here, and I could easily go till tomorrow or through the week
Oh,
and talk to you
yeah,
nonstop.
let's not be strangers.
In any case, yeah, so two more questions for you, and then we'll wrap it up. First one is, since this is the Medical Fitness Podcast, it's important to me that the listeners, and as I mentioned before, many of whom are clinicians across the spectrum of healthcare, understand the importance of building the bridge between medicine, rehab, and fitness, or how I would prefer to word it, because I'm just not really the biggest fan. This is a personal thing. I'm not the biggest fan of the word fitness. I'd rather have it the phrase be building the bridge between medicine, rehab, strength and conditioning, or medicine, rehab, strength and conditioning and performance. But I'm wondering if you can talk a little bit about why strength and conditioning is, and we already obviously alluded to this in what we've been talking about for the last X amount of minutes, but maybe if you could just build on a little bit for the listeners, why strength and conditioning is such an important part of the continuum of healthcare, and maybe some things that you think every clinician should understand about the field that we work in as it relates to both their practice and patient population. And again, you're probably just going to be piggybacking off of what you just said because you definitely alluded to a lot of that stuff. But if you have any other pearls of wisdom, I would love to hear it.
Well, I mean, I can, I can be like comedians. I could steal jokes very well. Josh Hagan at the Human Performance Collaborative is one of our head of that area, and in the performance innovation team, he's an engineer. But what we talk about is it's human performance we're interested in. And then from what I started as 18-year-old, human performance laboratory, we got away from that. Everybody has human performance that really needs to be augmented by a host of different variables. And I think that if we all say that we're all, whether we're a clinician treating a patient with cancer or treating a patient with obesity, or like myself with whoever number of things you could treat me for, you're dealing with the fact that ultimately it translates into performance, whether it be cognitive, whether it be physical, whether it be anything. So really what we're trying to do with strength conditioning is the fact utilize the tools within that domain to be able to impact a positive human performance and human function. And I think the other thing is in the clinical world, and back to our alignment and respect, you have to understand what you don't know. I always say, if the person that you're worried about, I always tell people all the time, I don't know anything, I know barely nothing. But the bottom line is you got to realize what you know and what you don't know, and then you got to find those people that have the three C's: the credentials, the competence, and the commitment to find a fellow spirit that you can attach to basically know that you can interface with them to try and augment what we call in the military, you might remember, force multipliers. So we're looking at the idea of you want people together in teams, clinicians, practitioners, everything that are working, technicians, whatever, to be force multipliers. That's the one thing I've used my whole career. I want everybody that's in my team to be a force multiplier together. We're bigger as a group than we are as a singularity. So I think that's really an important aspect. And it's really, as Josh would say, it's really coming down to what we're trying to do is enhance human performance, whether it be better tolerating or recovering from a pathology or dealing with a chronic issue. You're talking about human performance and what can we do on all the aspects, from technology, from medicine, from rehab, from strength conditioning, from recovery, to optimize that person's performance. Really, what it comes down to.
Good, love it, thank you. And let me also just say, listeners, um, uh, piggybacking off of what Dr. Kraemer just said, I can help you. So if I know from working in this field that many of you, okay, so that's all good news, but how do I find them? Where do I find them? How do I vet them, etc.? I'm a resource for you. I am the founding and current chair of the National Strength and Conditioning Association Special Populations Special Interest Group. My 3-year term wraps up this actually in a few weeks at the national conference, and then I step back into the vice chair role. And I'm really connected through the National Strength and Conditioning Association, and I'm just connected nationally. So can I hook you up, directly if you live in Topeka, Kansas, or something like that? Maybe, maybe not, but I definitely have the resources to be able to help you find somebody.
Yeah,
So I hope you.
that's what you got to do. I mean, it's finding people, and yeah, you're right. You got to find people that have the three C's and then have alignment with what you're trying to accomplish.
Exactly right. Yeah. All right. Last question. And this is also just something that the question is a little bit on a personal level, but I can't help but be curious your view on this if you're willing to talk about it. Um, again, I'm so fortunate to have known you for as long as I have, and to understand not only through my discussions with you, but also, I see the articles you put out through the National Strength and Conditioning Association, and occasionally in the Journal of Strength and Conditioning Research or whatever, you'll put out an article and it will talk about the history of this field. And I'm just huge in the importance of, we need to understand the history of our field, the evolution of the field of strength and conditioning, et cetera. I'm sorry, especially the evolution of our field. So, given that you're one of the forefathers of our field and having the luxury of being able to see many decades worth of change, and I'm gonna quickly quote an article, and then I'll have you answer this question. There was a 2020 article titled "Addressing the Confusion Within Periodization Research," and within it, and I'm going to quote the authors here verbatim. A troubling current trend in academics appears to be an everything we have been taught is wrong attitude, carried out with the intent to create controversy. And this trend has spilled over into sports science research, particularly as it pertains to periodization. Perhaps some or much of these issues are related to or influenced by social media. Researchers are now more connected virtually with others across the globe, leading to constant commentary, for better or for worse. Several of the authors of that particular article have been scientists for a long time, greater than 30 years, and we unanimously feel that today's students and young scientists are developing in a climate that is too focused on self-promotion and too often misses the big picture. In this article, they went on to talk about the importance of history. A lack of appreciation of history can fail to take the full picture into account and can lead to the mistaken view that we continuously need to reinvent the wheel. So, given the role you had, the major role, one of the founding fathers of the National Strength and Conditioning Association, and just strength and conditioning itself, how do you view what's going on in today's industry? Like the way I look at it, it must be. Again, I can't wait to hear your response. But if I were you, and I have done all this for the field, and I've seen it from the early on, and then see all this stuff going on with social media and all this self promotion and trying to reinvent the world. I mean, I'm sorry, the wheel. I personally would want to. It would be driving me crazy. So I'm just curious. How do you view all this stuff?
Well, I think one of the things, I guess you should send me the article. One of the things I will say is that history has shown us that, as my dad taught me early on, nothing ever stays the same. And the environment of the society, the people that rise to the top, they many times have different ideas of what success is and what it means, what they're trying to get out of it. Obviously, a lot of this is driven by money and capitalism. It's the same reason why we don't have any old professors teaching students anymore, because younger professors have found by the time they get the full professor, the money's all above them, and basically they make it by becoming chairs, deans, etc. So they're pushing and leaving that to. So we got a lot of situations where we fortunately have some really good young professors teaching young kids. So it's young teaching the young. Versus the old days where old professors were teaching
Yes.
the kids.
Yes.
But I think from the standpoint of that, I think social media is driven lots of parts of our society, from bullying to everything. So the bottom line is, and again, people have learned, just from the different reality TV shows, that in order to stand out, you have to make a statement. You got to stamp your foot on the ground and pretend you know something nobody else knows. You protect the mystery behind this. You do a lot of things. So social media will drive a lot of these things. And again, if you're caught up into that, confusion does exist, because, heavyweights is good, lightweights is good. Lightweights is better than heavyweights. Nobody gives you the context. Nobody gives you the facts. And we have to go back to what is the evidence-based practice. We go back to the book I wrote with Bill and Kirk English on evidence-based practice book, which is really a book gets lost in the mix. It really goes through the process of, okay, we'll take this idea, now let's go test it out. Let's look at all the aspects and evaluate how good it is as a concept, does it hold water. But people don't want to do that. And the other thing is that many times, unfortunately, it's the lay public that are suffering. Butter's good, butter's bad. Well, if you're on a ketogenic diet, butter's no problem at all. If you're eating tons of sugar, lots of butter may not be a good combination. So it's always the context of what we're dealing with. And you can't fault people for, again, wanting to make a name for themselves, because that's what gets more attention and money. I think in the old days, the way it worked out is that you were never given the ability to speak unless people saw your body of work before you spoke. I know at Penn State, in the old days, If you're sitting as a young professor there, I was an associate professor, you didn't, until you proved yourself and had a body of work that people would be interested in what you had to say, you just sat down and shut up. That's not the case anymore. Now you get
Yeah, I wish it was.
now anybody gets up with no body of work to state it, freedom and everything, and we do that. But it's just how the culture has changed and how social media has changed that. But again, it goes back to the fact there's nothing wrong with taking the opposite view of something and saying, hey, I don't really believe that. But again, I always ask my students, go back to the origin story of why that was found. Look at the
Yes.
context. And yes, there's we were opposites ourselves in saying weight training is good for women. That people that man. Okay, so yeah, so I'm not going to call the kettle black as they say, but I think the bottom line is that more thought needs to go into what both sides of the pancake need. If I'm going to take this side, I'm really going to push it. This is a bad exercise. Nobody should do it. Well, then basically, in all contexts, you're going to say that in all relationships. So the other side of the pancake says, okay, it might work here. It's not good for this, but it's good for that. How can we use it? How can we use the tool? But I do think it's just the culture we live in today. And that's thus one of the things I've found out is that people have to really spend much more time learning how to evaluate knowledge, whether it's anecdotal, whether it's put out there as pristine research. You got to look for the context. You got to look for what it says, who it's saying it about, and you really got to spend time using the evidence-based practice phenomena to really understand. Well, how does this fit in? Whether I'm a clinician or whether I'm a strength and conditioning coach, it really comes back to the same thing. I mean, you can imagine the dramatic effect on being a physician today in the world of technology, of drug changes going on faster than you could shake a stick at,
Yep.
and pharmaceutical changes and research. How can you manage all that? And again, it takes a great team of people with lots of different expertise to look at it, evidence based, then try, see. But again, much of the things that I think this article and the authors are speaking to is really saying that we're getting too many people that are affecting the lay public more so than anybody by confusing the fact that, hey, we can lift light weights and not have to do heavy weights. We don't need to lift weights and we're okay too, because when you say that, you get attention. And I've seen that happen over and over again, even in the last 20 years. It's just the state of where we're going and what's happening. And the only way you put a stop to it is you say, let's evaluate the knowledge, whatever that is, anecdotal, somebody says this, whatever. Let's analyze it, and then from there, let's see how it fits into a context of a toolbox. And that's the only thing I can say. But is it frustrating? Well, yeah, because a lot of times one of the other really kind of difficult things is that people who have put their lives in a thing, it's when you do personal attacks and things like that to try to drop somebody off the canvas, so to speak, because you want to be the guy at the top of the hill, and that's not right either. I think there's room for everybody, but that's where respect comes in. Common human dignity and decency has to be brought higher than it is in today's society too. So you look at the people, human decency and respect and truth and honesty and integrity, character, they're all being attacked on all fronts. So what we see in our little world is just a little tidbit of what's going on in more global aspects. So that's about all I could say. They probably, again, are waiting back for the old days where the body of work gave you the ability to say and hear. But again, nothing wrong with questioning, nothing wrong with any of the aspects of challenging ideas. But there are certain things like, are we really going to challenge the law of gravity? The law of gravity is pretty good. It may be different contextual. We can dimensionalize its understanding in the subatomic field or dimensionalize how it might or may not work. But again, there are certain things you try to dimensionalize the context for something rather than just try to destroy it or say something obvious just to get attention. And then you look at what their credentials, competence is, who is saying it, and that's part of the evidence-based practice. You respect it, but what are we saying, and how does it fit into our world to make a decision, because we're going to use that information to make a decision on. That's the thing we worry about most. Okay.
Yeah, love it. Thank you so much for your response. We're going to wrap this up. So I wanted to say to the listeners, again, his new book is titled "Developing the Athlete: An Applied Sports Science Roadmap for Optimizing Performance." You can find it on Amazon.com, and it's Human Kinetics Publishing. Dr. Kraemer, thank you so much for taking the time out of your busy schedule to be on our show. It's an absolute honor, and it's so fun to reminisce with you. And I'm going to say, I just hope that this won't be the only time. I hope that sometime in the future we can have you come back and talk about some of the things.
Stay in touch. Send me stuff. I love the interactions, and come up and visit sometime. Take care.
Absolutely.
Take care. Bye.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.